A very common phrase we hear from patients is, "I tested negative for Lyme at my doctor's office, so I know I don't have Lyme." Or, "My doctor says I have fibromyalgia because all my lab tests keep coming back negative." Lab tests, as helpful as they are not perfect. And this is certainly the case when it comes to Lyme disease. Here's why. It is well documented that the traditional two-tier test for Lyme disease is highly insensitive for early Lyme. Somewhere between 30 to 60% of early cases are supposedly detected. However, I would be willing to bet that the actual percentage is even lower. In order for a test to be validated, there needs to be known true positive samples that can be tested against a control. That's the only way you can tell whether the test that is being evaluated is giving accurate results. For this, the CDC has what's called a serum repository. It has been verified that these serum samples are from patients with well-characterized Lyme disease at all different stages, and that there are antibodies present against that particular bacteria. However, Johns Hopkins Lyme Disease Research Center has found that Lyme can actually evade your body's immune system. If that happens, then your body might not produce antibodies. So if you get a blood test that is only looking for antibodies, there is a chance of getting a false negative. The reported sensitivity of the tests that have been studied may be accurate, but they would only be valid clinically if the patient has produced an adequate antibody response. So research studies in a controlled environment do not always translate to what is seen in the clinic. So what do? First, if you test negative at your doctor's office, but you still have symptoms consistent with Lyme, seek out a Lyme specialist. And I'm not talking about an infectious disease specialist. They follow that same two-tier testing method that your doctor does. Go to someone who has been trained to specifically treat Lyme disease. iLabs is an organization that provides this training and can also help point you to a practitioner. In my practice, I use a number of different specialty labs to look for Lyme. I'll typically test for multiple strains of Lyme along with some of the common co-infections. I also look closely at the correlation between the clinical picture and the lab results. I've had a number of patients with a very obvious clinical history of Lyme, including history of a deer tick bite and a bullseye rash, and still test negative for Lyme despite being symptomatic. In some of these cases, a trial of treatment can also be quite telling. It's not wrong to start with your family doctor, but if you test negative, and even if you test positive, it's still best to seek out a Lyme specialist. Treating Lyme can be tricky, especially in chronic cases, but thankfully there are many good treatment options available, and a Lyme specialist can help you decide what will work best for you.